All right, so this is going to be looking at Scaption, specifically for the full canned and empty can test. So first and foremost, these are not great tests. You should probably already have a really good idea of what's going on with the shoulder from your subjective and maybe your functional test before you even get to this part. So I would not bank on this test in general. So probably what got you here is you've already done some of your impingement tests, be it the Neers test, Hawkins-Kennedy test, and now you're saying like, well, is there some sort of muscular component to this that happens to maybe incriminate the supraspinatus a little bit more? So the question is, where is the plane of scaption? In the book, it says between 30 and 45 degrees. Well, that's based off the scapula. So the position of the person's scapula is going to change where that person's plane of scaption is. Where things get thrown off is that the reference point for your degrees of horizontal ABA deduction is the body. But the plane of scaption, the reference point is the scapula, because you're trying to put that arm in alignment with the fibers of the supraspinatus. So if I bring this person, yes, you are a person, this person's arm up to this position, and I just look straight down that supraspinal fossa, that is exactly in line. So for him, this would be his plane of scaption. However, if this person lives in a more retracted world, this whole thing would be shifted posteriorly, and they would appear to be in more horizontal abduction. If he was protracted in his resting state, then he would be more this direction, and it would appear that he is more horizontally adducted. But the reference point of the scapula and the humerus are the exact same. They're in the same alignment. It's just the whole thing shifted this way or the whole thing shifted that way. This is fused, otherwise I'd try to move it for you. So a nice little reference point in the clinic would be to identify that spine of the scapula. And it's not exactly right because there's a kind of a little bit of an angle to it, but that's my rough point. I'm going to bring this up so that this arm is roughly in line with that spine of the scapula were I to draw a line straight through the center of it going out that direction. So that's how you would find your plane of scaption. Now, when we look at the full can versus the empty can, this would be the full can. So the idea is that the elbow is going to be pointed up. You would load there. If we look, the greater tubercle is a little bit more posterior here. So the idea was to bring them in. When you bring them in, they're going to be more in this plane, and it'll be a little bit more aligned. Arguably, it's kind of like halfway between there would probably be the best alignment of the fibers to go into their insertion on the humerus to load it. But like I said, this isn't the best test. In fact, when they looked at EMG, they found that when you do this test, you're firing like 15, 18, something like that muscles, because everything has to stabilize, including the deltoids. So it's not exactly an ideal test. Now, from a clinical standpoint, your positives would be pain and strong, which would suggest that you're probably dealing more with a nociceptive problem, potentially a bursal type of problem. Whereas if you push and now all of a sudden you have concurrent weakness, the idea was that this is a muscle injury. So you've got a little bit of muscle healing going on. I would argue that if you have somebody who has high irritability, easy to flare up the pain and takes a long time for it to go away, two things. One is this needs to calm down before you really get into that. So you would start off at your protective phase to try to bring down symptoms and then retest when they're a little bit more moderate irritability. The other thing is that if this is really flared up and it's been a few weeks, if not a couple of months, I would then start going into the cervical spine to see if we have an increase in sensitivity across this entire innervated area. Remember that a lot of our tests for neural injuries here look more at your C6, actually more C7, but C6 and 7 down, not so much 5 and 6, which is what innervates that posterior rotator cuff. So just food for thought there. I hope that explains this test a little bit more.